reports. And so we'll move on to item number 5, which is the COVID-19 staff update. Okay, it looks like we've got everybody. Marilyn, are you kicking it off?
I am. Thank you, Marilyn Mann, Health and Human Services. And well, we're pretty excited in public health because it looks very likely, and we're anticipating that the state is going to assign us to the yellow tier today. That's our anticipation based on what we know our numbers are. And, you know, when the assignments happen at noon today, any assignment changes and changes in tier status go into effect tomorrow. So that primarily means a lot of increased capacity across multiple industries and sectors and certain venues. So those are that's very good news for events such as our upcoming meal days. And the other things to let you know, we did have one case added last week, but our case rate and positivity rate remain extremely low. A good indication that we're getting some good vaccine and herd immunity level building in our community. Yesterday, we hosted a small forum with some of our faith community leaders, and we had Dr. Richardson, Dr. Ingblade, who's the Chief Medical Officer for Northern Inyo Hospital District, and Colleen McElboy, who is a pediatric nurse practitioner. Just be available to answer questions that perhaps people who have some hesitancy about getting the vaccine or have some concerns or questions about issues related to vaccinating their children. It was an opportunity to have those one-on-one conversations. And we did record that. We are going to be converting that recording into a YouTube posting that we will have available on our website. So with that, we are just working right now, just to let you know, we're in the process of taking the steps necessary to rescind our local face covering order. Now, that does not change the face covering requirements. As a reminder, our order went into place earlier in the pandemic period in order to ensure our ability to ensure safety in various sectors. And it is one additional layer that we've had in place. However, the state's face covering order will continue to be in place. We are just we're in the process of rescinding ours in an effort to ensure that we are in line with the state over the next couple of weeks, as we anticipate that they will be making adjustments to their face covering requirements. We don't have the details of what that will look like, but we do not want to have any barriers to those changes being able to be implemented. So I think Anna is going to provide us some updates around our vaccine rate, and I'm going to turn it over to her.
Thank you. And Marilyn hit all of the major key points. So I just want to add a couple of updates around our information on overall vaccine coverage. We did learn later in the week last week. We have, for the past several weeks, as we put our vaccine information out on the website, as well as through our weekly vaccine updates that are that go out by email to those who've subscribed to receive updates via email. We had been told by the state several weeks ago that Indian Health Services data could not be pulled into the statewide vaccine coverage data, and they have been working to correct that. And so while we did continue to add in our TOYABI numbers for last week, we received clarification later in the week from CDPH that they were in fact pulling that Indian Health Services data in. So we perhaps had some of our vaccine double counted last week in our overall numbers. We will not continue to do that. We'll continue to use the Indian Health Services data that is pulled into the state rates going forward. So we've had some fluctuation in our overall coverage rates from week to week, also because the denominator of individuals who are eligible has changed as we've expanded eligibility. So at this point, we are looking at coverage rates throughout the state and at the local level based on the total eligible population over the age of 12. We are still tracking very close to the overall state vaccine coverage rates, and specifically for Inyo County today, we're showing that the percentage of our population that's had at least one dose of vaccine is at 62.3%. So again, a little bit lower than what we reported out last week because we're using the Indian Health Services data that the state's pulling. It's a little bit lower than what we had been adding in and potentially overcounting last week. Also of note, the percent of the population that is fully vaccinated in Inyo County is currently at 52.2%. That's tracking a little bit of ahead of the state rate, which is at 49.7%. So still doing a good job in getting people vaccinated and fully vaccinated. And certainly last week had the opportunity to do quite a few second doses. So we'll see those reflected in our data going forward as well. So getting good coverage rates through vaccine, and we'll be going forward with our current distribution plan is to increase the number of providers who have Pfizer vaccine available, because that is the vaccine that is currently approved under the emergency use authorization for ages 12 and over. It's the only vaccine that covers that 12 to 16-year-old age group, 12 to 17-year-old age group. So we are, sorry, talking too fast, the 12 to 15-year-old age group. So we're working on getting more of that vaccine available through the normal clinics that are happening throughout the week through our different providers. And so have expanded that to the Valley Health team in the Bishop area, as well as Northern Inyo Hospital and Vaughn's also in the Bishop area. We'll continue through our other providers to look for ways to get that vaccine available on a regular basis as some of the storage and handling guidance changes to make that a little bit more manageable. So we do anticipate that we'll have more Pfizer available in coming weeks. We also are focusing our efforts in public health on some communities that may have not been able to have access. So specifically this week, we will be focusing on our populations that are served through some of our meal services and behavioral health services, individuals who may be experiencing homelessness and receiving services through some of our community-based organization partners. So we will be doing some more targeted types of vaccine distribution out of public health over these next couple of weeks as well. And those are the updates that I have for vaccine. See if Dr. Richardson has any additional updates.
Good morning, board. I don't have much to add to what was already said, except there's two issues that are going to be coming up in the near future. And you're probably aware of them in terms of this vaccine verification. That's going to be an issue that's going to be often discussed, and it's a political issue right now. One state recently banned the use of a vaccine passport, and it's coming up in various areas after we've vaccinated everybody. They're talking about maybe a digital health credential. This is going to be something that's going to be talked about and discussed, and it's a real conundrum for most people. And looking at some of the polling data, it's interesting because it is a political issue. They had a recent poll that 47% of the Republicans opposed it, but only 10% of the Democrats. So there's going to be an issue over that, and it's going to overrun or overflow into local businesses and venues. That's one thing that's going to be quite difficult to manage. The other issue is that we're going to be faced most likely, and it's often discussed, about a booster. And that depends on whether or not we have a significant variant in the circulation. It may be 6 months yearly or maybe 2 years. And that depends on the variant that may emerge. If you vaccinate a population significantly, the variants don't get a chance to arise. So then the booster would be spread out over time, like possibly 2 or 3 years down the road, just to give you a booster on the well-known COVID-19 that we see now. But if a significant concerning variant arises, then they're going to have to tweak the vaccine and give you a booster a lot earlier. And that could be 6 months or even maybe yearly, maybe sooner. Moderna's already working on a booster. So that's going to be something that's going to come up in the near future. One of the concerns I have about this vaccine verification, it excludes everyone that has not been vaccinated, and there's a significant number of those, or unable to get vaccinated. And if they have underlying health conditions or philosophically opposed to the vaccine, that could make up a large group, and then they get excluded from anything that requires a vaccine passport or verification, as you might call it. So those are the two issues I've seen that are going to crop up. We're doing well with vaccinations in our county. When you do that, you suppress the ability for a variant to emerge. So that's all I have of interest and concern for the near future.
Okay, do we have any questions for the team?
Well, I had one for Dr. Richardson. He mentioned the digital health credential.
Yes.
And I guess I was just wondering, you mentioned kind of in a broad way. You mentioned it in a broad way. And I'm just wondering what I keep seeing a lot of different media. What's the general direction, I guess, in California specifically? Because like you said, you see a lot of news and it might be from other places. So is there discussion as a direction in California?
I have not seen anything from California. I think it's going to be a statewide or the federal government. Originally, they did not come out and say they were opposed to it. So it became a political issue, I believe. But I think they're going to turn it over to the states and the local governments to decide if they want to use it. And obviously, the private businesses or sports venues will be, they're going to decide whether or not they're going to use it. I think there was a couple of large sports events over this past weekend that you were required to show vaccination or immunity to the disease from prior contraction of the disease. So it's going to be a real issue, and I don't know where it's going to go. It's just something that is going to be something we're going to have to be faced with eventually.
Yeah, thank you. I noticed there were some lawsuits in Santa Clara County regarding this very topic. So I kind of wondered.
In my opinion, I'm opposed to it, but it's being pushed.
Yeah.
You're going to either have to have a barcode or digital, in the age of digital, on your phone, It's hard to know where it's going to go, but it's going to happen fast.
Well, thank you for that update.
We have a hand raised from Linda Chapman.
Yes, hi. Yeah, as far as vaccination certificates, I think maybe it will be of wider importance for people who are traveling internationally. I know for a long time, when you go to a certain country, sometimes you are asked to get a vaccine for yellow fever, for example, which you probably won't encounter in our country anymore, I'm guessing, but you might encounter it in a different location. So, and I'm guessing that when people from other countries travel here, that the issue of whether or not those folks have been vaccinated for COVID might be of concern to our country generally. So I think it's an issue that isn't going to be going away if you're just planning on staying in your own community for the rest of your life or within the state of California. Maybe it's not such a big deal, but I think it's particularly for people who are traveling on vacation or for business. If you're going to be going to other places in the world, I think that will be, you should be prepared to demonstrate that you've been vaccinated, whether it's a digital format or, you know, I have my little CDC yellow vaccination card that I've had for the last 10 years. And I made a point of asking when I participated in the clinic here, of asking them to also put their little sticker in my yellow vaccination card so that when I want to travel, I am ready to go. I don't have to backtrack and, you know, find out, you know, who's going to help me get this and that. I've got my yellow card. I'm ready to travel. So I think that needs to be kept in mind for whatever passport stuff ends up being developed for US citizens. So thank you.
Thank you, Linda. Does anybody have any other questions or comments for the COVID team?
I have one comment just to for Dr. Richardson. So I had to be on a panel last week and talk about our response to the COVID emergency. Marilyn and Clint helped me also, you know, help me some get my thoughts or our perspective on how things went. But I wanted to tell you a line that I kind of used in the presentation, and that was that, you know, counties across the state did have, you know, there was a lot of upheaval, I guess, or in some cases between boards and public health officers. And what I said is that I thought our public health officers' bedside manner matched our county's you know, approach to things. And so I was going to tell you that I really do appreciate that, you know, we have been through the last year and a half with you, and you have matched, I think, at least many of my constituents, you know, on both sides. You provided that approach that was a good, straight talking bedside manner that we appreciate. So I wanted to pass that on to you.
Well, thank you. Thank you very much.
Go ahead, Dan.
Yeah, I just wanted to pass on as we seem to be winding down from this year plus of difficult decisions, that thank you to the team that has worked tirelessly to figure out how we can protect our community and balance that with having businesses do as much as they could. A was thinking about the public comment that we had last week when somebody said that only 1% of our, or around 1% of our population has died from this. 1% is a lot of people. 38 people is a lot of people. I don't think any of those families would say this really didn't matter. So thank you, team. I'm sure we have saved people's health from the long hauler and probably saved some deaths, and that's important. Thank you.
Okay, thanks everyone. I think we'll wrap up this item, move on to the rest of our agenda.
Can I just say one thing, Mr. Chair? 1% would be a heck of a lot. We haven't lost 1% of our population to this, so I just want to make a note. So.
Okay. We'll move on to item number